From my home, I am 10 minutes from a medical facility. I can also take a 15-minute bike ride to receive health-improving medicines at any time of day, any day of the week, at my nearest CVS center. I don't have to worry about not having the financial stability to treat any of my health issues, nor do I have to worry about whether or not I will even be able to see a doctor. I can maintain my health all thanks to my family's health insurance. Hundreds of millions of people around the world are not as lucky and do not have the same luxuries as I do. The Global Burden of Disease study states that in 2015, there were 2.74 million deaths due to lower respiratory infections. Additionally, the World Health Organization states that in 2016, there were approximately 57 deaths per 100,000 people in lower-income countries due to diarrheal disease. While there are indeed modern medicines to cure such illnesses, malaria and tuberculosis are still at large in third world countries, killing approximately 38 and 34 per 100,000 people, respectively. Care for the sick can also cost the families of those afflicted an inordinate amount, something that is possibly more deadly than the disease themselves. It was found that more than half of the deaths in third world countries were a consequence of communicable diseases, maternal causes, and nutritional deficiencies, and most were preventable or curable with the right medical care. According to the Borgen Project, a U.S. organization to help the poor, 20 million people in third world countries die as a direct result of poor medical care. 20 million is too large a number to fathom, too large to ignore. Numbers are numb to the incalculable suffering that people around the world have faced because of poor or even no medical care. However, these issues are most certainly not unsolvable, especially to Doctors Without Borders. Doctors Without Borders is an international humanitarian and non-profit organization started in Paris, France in 1971. They have been going into very dangerous areas that many other organizations simply won't, such as the war-torn country of Syria, criminal detention centers in Libya, and South Sudan, a country experiencing a civil war. Doctors Without Borders is based on the fundamental concept of altruism. They provide healthcare to those that would have no means of getting what they need otherwise. They provide hope to the hopeless when others won't. Working to improve the health of the world, Doctors Without Borders has completed and is currently carrying out numerous missions across war-torn, disease-ridden, and impoverished regions, including many African countries, Cambodia, Libya, Sri Lanka, and Yemen. In 2017, Doctors Without Borders had, as stated on their website, ran 462 projects in 72 countries. Besides having been in operation for almost 50 years now, Doctors Without Borders also uses approximately 90% of the donations that they received purely for funding their programs and projects. Give the gift of life. Donate to Doctors Without Borders and support Project for Awesome.